Can you hear me well? So today I was tasked to talk about the importance of infection prevention and control. And thank you for being here as leaders in your respective units. So these are my disclosures. And I will start right away. So, as you know, IPC means infection, prevention, and control. But today, we will focus on hives. Who knows Japanese? Wala naman. First question ko pala sa inyo, are you guys ready for the lecture? Yeah. So in Japanese, what is yes in Japanese? Hi, di ba? Hi. Okay. So yun yung papag-usapan natin today, no? Hives, or healthcare-associated infections. Ano tong healthcare-associated infections? Or para short, I'll just say hi. It is an infection in a patient during the process of care in healthcare facilities, no? So including Asian hospital, no? Kung magkaroon man. And it should not have been present at the time of admission or nag-i-incubate na siya at that time. Pero dapat wala pa, no? No, not yet, dapat no infection na present on admission. And it includes infections acquired also in the hospital. Pwedeng mag-appear after discharge or occupational infections. So, kung kunwari tayo as healthcare workers, magkaroon tayo ng infection from the hospital, that is considered a hive. No? And as you can see below, on the left side, no, those are the microscopic appearances of microbes or germs, no? Microbiome, no? So, isa dyan, virus, may parasite dyan, bacteria, no? And in the environment, no, the microbes are also go around. Tayo, we go around, but microbes also go around. Like for example, it can be present in the air, no? It can be present in soil, no? It can be present in water, and it can be present in bodies, no? Our bodies and patients' bodies, no? So yun yung isa sa mga, hindi natin sila nakikita, but they are there. So definitely, our goal will be to protect. And who do we protect first and foremost? Of course, the vulnerable or weak patients. No? Sino yung mga weaker patients? No? Siyempre, puno ng pasyente sa ospital. But, sinong pinakamahihina? Sinong first priority? Of course, all are our priority. But first priority will be our ICU patients, those with invasive devices, those with underlying medical conditions, no? Those on steroid and chemotherapy. Kasi steroids and chemotherapy, nakakapanghina, they have their benefits, of course, but yung side effect nila, medyo humihina ng kaunti yung katawan. No? And those who had recent procedures, no? So yun yung mga first priority are vulnerable and weaker patients. So kita nyo naman dyan sa picture, no? That's one example of someone in the ICU and having multiple lines, no, or gadgets, most likely, dami na nakadikit sa kanya. Yan yung mga first priority. But, again, we protect everyone. Try to protect everyone in the hospital against hives. So, again, where do we protect them from? Yung hives na ito, central line associated bloodstream infections, no? So, central lines are, di ba, nakikita natin madalas swero, no? Yung nilalagay dito or dito sa arm, usually what we call those peripheral lines. Pag central line yung nilalagay minsan dito, pero umaabot hanggang dito, no? Kasi so mas malapit sa core or center ng body, that's why they're called central lines. At pag mas na-infect yun, mas grabe usually infection. Pag peripheral kasi nandun sa dulo, so medyo not as serious kung magkaroon ng pamamaga or infection. Now, sonda. Ano yung sonda? Pag merong kailangan i-monitor yung urine output, no? Ilalagay ng set ng catheter, urinary or Foley catheter, no? Pwedeng ma-infect yun. Okay, so we call those catheter-associated urinary tract infections or UTIs, no? Pag nalagyan tayo ng endotracheal tube, pag nahihirapan huminga, kailangan natin idikit sa respirator, no? Tawag doon, ventilator-associated pneumonia, pag nagkaroon ng infection sa lungs, no? And of course, surgical site infections, no? Yun yung mga talagang ayaw natin mangyari sa mga pasyente. Although there is an inherent risk. So, pag naglagay ng central line, nagkaroon ng urinary catheter, pag nalagay sa respirator, no? But again, nilalagay lang naman natin yun if it's needed, no? So there's a risk and benefit ratio. Hindi natin ilalagay yung mga yan, hindi kailangan. But the moment that we place them there, no, we need to make sure that we do our best to reduce or decrease the chances of hives. No? Yeah, so ito yung mga example, no? Indwelling Foley catheter, central line, mechanical ventilator, and of course surgical site infection. No? So bakit? Ang mga mikrobyo kasi, ano yan? Mahilig dumikit sa mga foreign bodies, no? So pag so kung meron kayong Foley catheter, central line, ventilator, mahilig sa plastic, no? Didikit sila sa whatever material these are made of. They want to stick there, no? Tawag ko nga, medyo parang squatter itong mga to, eh. Yung mga mikrobyo, pag merong something, no? Something new, didikitan. And then pag dumami sila, then it becomes an infection. No? So, I'm sure si Justine, no? And the others, no? Have talked about the IPC program, no? An effective IPC program is essential to prevent and to reduce hives and even antibiotic resistance, no? So we also prepare for, manage, and prevent infectious disease outbreaks. And actually, we were successful during the COVID-19 pandemic, no? So, but the IPC program, of course, will not be based on one person, will not be based on that, but will need the help of everyone. So, before other things, no, let's first talk about how diseases are transmitted. Of course, it starts with the infectious agent, yung mikrobyo. But yung mikrobyo, may tinitirahan, yun yung reservoir, no? And pag lumabas siya sa reservoir, so, siyempre tawag doon portal of exit, no? And then yung mode of transmission is paano ba galing sa portal of exit, na-infect yung ating pasyente or tayo, no? Siyempre may mode of transmission, no? Paano siya na-transmit. And portal of entry is paano pumasok, whether sa atin or sa pasyente, no? And yung pinasukan is of course the host, no? The susceptible host. And ngayon, pag napasukan na yung host ng infectious disease or pathogen or microbio, no? Then, dahil nga infectious disease siya, pwede actually niya mabigay yung infection sa ibang tao. So yun yung basically how diseases are transmitted, no? Simple naman, eh, no? Pero bakit, paano kayo papasok dito, no? We need you, no? Kasi nga sabi natin kanina, you know, one person will not cut it. A couple of people won't cut it. The hospital is so big, no? So we need you, no? So, yung nasa kanan, kilala niyo siya? Anyone? Yung picture sa kanan. Yan si Abraham Lincoln, no? Okay? Siya ay yung dating presidente ng US, tama, correct, USA, no? And what was, you know, President Abe Lincoln, what was he able to accomplish, no? He was, he's foremost in, you know, he's most popular in being able to end slavery, no? Dati kasi, di ba, they had slavery in the US, no? So, si Abraham Lincoln was able to end slavery, no? So kayo, since kayo yung leaders in infection control, no? Magiging parang Lincoln, parang magiging Lincoln kayo, no? Pero kayo, hindi slavery. You will hope to cut, no, the chain of infection, no? The chain of hives, no? Hospital-acquired infections. So, again, we are hoping that you will be the ones to cut the link dito sa chain of infection na ito. And yan, kayo yan. So, Hopefully, if you want to read about Abraham Lincoln, do so. But for our purposes, we want you to be the leader. Lincoln was a leader, in your unit, and hopefully you can also end the chain of infection in your units. So, just a couple of things, standard precautions. Ano ba tong standard precautions? Standard precautions are, of course, measures that aim to protect both the healthcare practitioner, us, and patients from infectious agents. Pag sinabing standard, dapat lahat ng tao sa ospital ginagawa ito. So, it's required in all healthcare settings. So, kung hindi nyo pa ito ginagawa, dapat i-memorize nyo na yan. And foremost is, of course, hand hygiene. We should be performing hand hygiene all the time in the hospital. It has been proven that that is one of the most important, if not the most important measure that we can do ourselves. Of course, environmental cleaning. So, kailangan medyo malinis. Dapat malinis talaga yung environment, especially in a hospital with vulnerable and weak patients. And then injection and medication safety for the nurses here. It's of course very important that the way that you inject is in a sterile manner. How you prepare your medicines dapat sterile so that you do not introduce yung mga mikrobyo na yon into those supposedly and should be sterile medications. Of course, yung risk assessment. Pag umikot kayo sa hospital at may nakita kayo na, uy, delikado yan, baka delikado yan sa pasyente, you call it out right away. You can actually act on your own already and of course inform infection control or inform your supervisors. If you're the supervisor, you can already act initially to reduce that risk kung may nakita na kayong risk. And of course, personal protective equipment. Natuto tayo dyan sa pandemic, and we use that a lot, because there really are some bacteria, microbio, viruses, pathogens, that will really need personal protective equipment for us to use. Of course, reprocessing of reusable medical equipment, dapat ginagawa talaga yan. Waste management, medyo mga simple, but still cardinal and very important, in the prevention of infections. And then respiratory hygiene, cough etiquette, pag nakuha tayo, we need to at least cover our mouth, whether with our arm, our hands, But if we use our hands, of course, we need to do hand hygiene afterwards. So these are all the things that we should all be doing. And alam nyo na yan, but many times, dahil busy, and that's a common thing, it's not an excuse, but even if we are busy, it's still our job to protect patients. So these are things that we really, really need to do all the time, 100% of the time. And ang ano dyan is, what if our family member is admitted to Asian hospital or whichever hospital, Siyempre gusto natin safe ang ating family members. And it starts with us, And we should actually build a culture, Because if it becomes a culture of prevention, and standard precautions pa lang yan, malaki nang mababawas sa chances of highs in patients coming into the hospital. So, just a couple of things about transmission-based precautions. Sulat dyan, contact precaution, droplet precaution, airborne. Ano bang difference? Contact, kasi nga sabi natin, yung bacteria, viruses, microbio, pwedeng nasa environment. Pwedeng nasa katawan din natin. Pwedeng nasa katawan din ng pasyente. Contact precautions ay parang it's just a barrier. Parang naglalagay lang tayo ng fence, between us and the pathogen. So, alam naman natin, yung first picture, kung paano ilagay yung ating gowns and gloves. These are examples of transmission-based contact precautions. Ngayon, ano difference ng droplet and airborne? Makikita nyo kasi yan sometimes sa mga pinto ng ospital, droplet precaution, airborne precaution. Ang droplet precaution is also a form of respiratory transmission. Pero pag sinabing droplet, yung hininga natin, yung mikrobyo wala sa air mismo. Nandun siya sa laway, sa moisture, na galing sa atin or sa pasyente, no? Pero, ang maganda sa droplet, hindi babagsak na siya in 3 feet. Okay? So, kung kunwari, ako, tapos for example, siya, kahit hindi ako nakamask, in 3 feet, babagsak na yung droplets ko. So, hindi talaga siya mahahawa. Pero, pag mag-usap tayo ng medyo malapitan, mahahawa yung pasyente. So, that's droplets, no? But dahil nga sa atin ngayon, sa Asian Hospital and many other hospitals, required na yung mask. Talagang the mask already solves the problem for droplet precautions already. No? So malaking tulong na yun just with the institution of wearing masks for those in the clinical areas. No? Now, the difference with airborne is pag airborne kasi, pag like COVID, no, like TB, pag huminga ka, naiiwan sa ere yung whether the virus or the mycobacteria, for example, no? So, ibig sabihin, huminga ako ngayon, tapos nakaalis na ako, nasa ere pa rin yung microbio, no? So, pag ganoon, tapos mas maliit pa usually yung mga microbio na yun. And that, therefore, pag airborne, mas kailangan yung mas magandang mask. Kaya, kung makikita nyo, minsan N95 yung kailangan, no? Or KN95. Although sa atin, syempre, we prefer the KN95 or the respirators. Kasi nga, tumatagal sa air pag airborne. No? So those are the things that you have to consider also. No? Kaya nga pag may pasyente, tapos nakita nyo, uy, umubo to tapos may trampaso to tapos walang nakasunod na droplet precautions. No? So pwede yung isuggest agad, uy, kailangan mag-droplet precaution tayo. Pero like I said, yung droplet, na-solve na yan with us being masked all the time. You know? So mainly ngayon, ang focus natin is airborne and contact. So pag nakita nyo, uy, drug-resistant, meron tong drug-resistant infection So dapat mag-contact precaution tayo kasi baka colonize sa katawan ng pasyente. Ayaw natin ma-transfer sa ibang mga pasyente. And of course, airborne. Pag medyo alam nyo na TB siya or SARS-CoV-2, COVID-19, measles, no, chickenpox, those are examples of airborne transmission. Okay? So again, pag droplet, simple mask will do. But for airborne, usually N95. So, it's important for you to really help in recognizing risk. No? It is a skill, and as a leader, pag medyo, magaling na kayo, you also transfer it, the knowledge of recognizing risk to your unit mates, no? Or the other people that you work with. It is a skill, no? And all of us should develop this skill to perform for both ourselves and for patients, no? So we need to be alisto, identify sources of infection and or actions that can lead to infection so we can act, no? And these are the hierarchy of controls. I won't go through these things in detail, no? But it's generally simple, no? Pinaka-importante, elimination going down to PPE, no? Lahat sila importante, pero pinaka-importante yung pinaka-nasa taas. Pag sinabing elimination, tanggalin talaga yung risk altogether. For example, COVID patient, tapos gusto pumasok ng isang walang COVID na family member sa loob ng kwarto. Siyempre, the best would be wag na. Okay? Hindi ka bakunado, for example, wala kang COVID ngayon, huwag ka na pumasok. So that's elimination. No? Substitution naman, for example, sa OR, no? Ito yung nangyayari ngayon doon. Sa OR, di ba, pag magbibigay ka ng, nagpapasahan yung surgeon ng sharps, okay? Tapos, di ba, gusto natin ilagay diretso sa kidney basin, for example. Medyo narrow yung kidney basin. Pag pinalitan mo yun ng mas wide na kidney basin, nababawasan yung chances na matusok. So sa substitution, engineering controls, we've done that during the COVID pandemic. Itong room na ito, meron tayong good ventilation. Okay, so that one is an engineering control. Ganda yung circulation air in this particular room, no? Administrative controls, for example, policies, things like that will reduce infection. And of course, ang pinakamababa is PPE. PPE kasi is only individual protection. Yung iba medyo mas higher level protection. But those are all still very important. So, in the implementation of an IPC program, and all of you are part of this, no? It is a process and not just an event. Example, today, this is an event. But the process of implementation will continue after you have left here and you've gone to your respective units. Okay, yun actually yung importante. This is just the start, no? And it does not happen overnight, so we will really need your help. Each professional or the team itself, no, needs to work collaboratively, need to help each other to determine the best way to implement IPC. So we work with IPC Unit, no? And this will more likely be successful kung multimodal, meaning different methods, no? And yun yung ginagawa namin every month and we meet kami. Of course, it's better if, for example, you have inputs, you tell us, no? Kasi syempre we try to wrap our brains, but we don't know everything, no? Sometimes you see something in your unit that needs to be changed and you have a suggestion. You can tell us, no? So again, we need you, no? Alright? So you are LINC, Lincoln, leaders in infection and prevention and control. So hindi lang dapat isa, dapat marami, no? So this is Asian Hospital. Bakit maraming kailangan? Kasi tingnan nyo naman, this is Asian Hospital. Ang laki-laki. Kaya ba ng isang tao or whoever, the IPC unit, ilan lang sila, hindi nila kayang to prevent infection, reduce infection,